Hi, welcome. We're going to cover chapter 16 today in Global Health, which is mental health. Okay, let's get going. Now, there is a burden of mental health globally. We see common problems in the United States, we see common problems in Asia, common problems pretty much everywhere. 1/5 of the world's population suffers from this disability in one form of mental health or another, which impacts them on a daily basis, whether it's providing food, eating properly, taking care of themselves, taking care of their children, or staying in a relatively adequate mental state of mind where they can function normally. Okay. Now, if we go to figure 16.1, it talks about the years lived with disability, okay, which is YLDS. Which shows that about 30% of the population have mental and substance use disorders. The next chart beside it shows years of life with years lost of life, which shows that there's self-harm and mental substance abuse disorders. And then the total we see there is the disabilities adjusted life years, which shows what happens. Now, as we can see, years lived with disability far outweighs the disability adjusted life years, but that doesn't mean that they don't correlate. A lot of times people that have disabilities end up having a shorter lifespan because the disability stops them progressing and taking care of themselves. Their mental disorder may not have killed them, they may have died of another medical condition, but the mental disorder may have exacerbated or prevented them taking care of their other physical condition properly. For example, if you have a mental condition and you have diabetes and you're not taking care of your diabetes, you will die of the diabetes, even though the mental condition stopped you taking care of yourself. The same thing happens with heart disease and blood pressure and everything else, not just in the US but globally. Okay. Now, the next slide talks about mental health and burden, and what we can pretty much determine from this slide that there are risk factors that have been identified globally, and unfortunately these factors aren't conclusive to say that any one person is going to have a mental condition. The risk factors are out there and they impact people differently. Okay, that's the point that we have to understand from here. Mental conditions or mental illnesses arise from a myriad of different factors. Biology comes into play, your genetics comes into play, the development, environmental factors you grow up in. If you're in a child that's in an abused home or not getting enough nutrition, that can come into play. People get bullied now, comes into play for mental conditions. Cyberbullying, for example, is something that's so prevalent now that it affects so many children, and parents are unaware of it because they're not seeing any physical ramifications of it, because children come home, they watch their TVs or they watch their computers and they pick it up from there. Okay. Figure 16.2 discusses years lived with disabilities, YLDS, and it shows all the main disabilities that we see out there. Now, the biggest one we can take away from this chart is depressive disorders. From that, we can look at the next biggest group, which is anxiety disorders, and then alcohol abuse, drug use, schizophrenia, bipolar disorder, and the others, which are post-traumatic stress disorders and other things that come into play. But the depressive condition is the one that's most prevalent. Everyone goes through depression through their life. Some people can rebound from it quite easily. Other people take a lot longer to get through these conditions. And their rebound may not bring them back to an adequate state of mental health or state of physical health where they can recover and move on in life. Okay. The next slide is mental health and human rights. Now, basically from this slide we have to understand that the main goal is to improve the quality of life, not just for the patient, but the people around the patient. Okay? Now, improvements can occur because of therapy, which is one of the main ways that people go through a lot of these conditions, is by talking things through and figuring out sufficient plans. If therapy isn't sufficient enough, then we use medications, and we have other support groups out there. Now, it's important to understand in developed countries like the United States, if you have a condition, there is a support group out there for pretty much every condition that you have, okay, or that you could come into contact with. In other countries, there are no support groups, and a lot of times people's families inhibit their development and improvement because they try to negate or ignore the condition that's occurring. Okay. Now, one of the biggest concerns that we see is schizophrenia, so we're going to deal with that one first. Schizophrenia is a mental disorder where people have delusions, which is where they have a false belief of something in spite of contradictory proof. Hallucinations, which can be auditory, they're hearing it, visual, they're seeing things, or tactile, they're feeling things. Okay. As the schizophrenia progresses and becomes worse, these hallucinations can also be taste sensations as well that are attributed to it. Now, as people age with schizophrenia and as it becomes more progressive, their thinking patterns become totally disorganized and non-concrete. They start having speech impairment, and their decision making becomes impaired because of that. Now, the impaired decision making may be not taking care of themselves, feeding themselves, giving themselves the medications, or doing the wrong thing. Sometimes these people have auditory hallucinations where they're hearing voices that are telling them to do things that they shouldn't be doing. Okay. Really what happens in these situations is these people start hearing these voices and they ignore them, they try and get help, and over time they start listening to what the voices are saying, and it's easier for them to go with what's being said than try to ignore it. Okay. Now, one of the positive or psychotic symptoms are accompanied by negative or deficit systems. It's a big statement on the slide here. Okay. A psychosis type symptom is not a good one to have, okay? Because it is going to impact your quality of life. It's going to make you harm either yourself or someone else without consciously trying to do it. So if you start hearing voices or you start feeling something's just not right, get help, okay? In the United States, we're actually fortunate to have people that help provide care for us. In other countries, you may not see that. We'll be discussing that later. 7 per 1,000 people will be diagnosed with schizophrenia during their lifetimes, okay? So it's 0.7%. Most diagnoses are made in individuals who are younger adults, usually 30 to 35 years of age was the number that we're seeing. And we provide therapy, medications to try and help relieve some of these symptoms and achieve some degree of remission. Unfortunately with schizophrenia, once you have it, you will always relapse with it. So you have to keep taking the medications and getting the therapy. If you go off the medications because you feel like everything's normal, you're going to have a relapse. The schizophrenia is going to come back, and unfortunately once they have these relapses enough, they go off the medications, they don't go on. It becomes very, very hard for them. The main reason people go off the medications is because it makes them feel like there's something wrong with them. They don't feel right, they feel like there's something missing. So they come off the medications, and unfortunately even in America we have a lot of people with schizophrenia homeless, living on the streets because they can't provide sufficient housing and food and nutrition to have a home or take care of themselves, which leaves them destitute. And regrettably, because these people, a large percentage, are younger adults, they have children, they have other dependents that end up being homeless and on the streets with them. One of the good things about the United States is we're trying to fix this homeless situation in most states. And unfortunately in some states the condition or the situation is so bad there's very little they can do. Some places they have tent cities now where the homeless are living in underpasses and living in tents in pretty much urban environments or city environments, and there's nothing they can do because there's not enough housing or not enough places to place these people for help and to improve the quality of life. Also, one of the problems with schizophrenia is the stigma arises basically because of the negative attitudes, and these stigmas come from families, from friends, from people, from media, from people in general, and that just makes it harder for these people to progress and get the help that they need. Okay. Figure 16-3 discusses people with schizophrenia with regards to specialty mental health care provided to them. China, for one example, is one of the countries that provides a lot of care for their mental affected individuals, especially with schizophrenia. And if you look at some of the third world countries like Iran, India and Ethiopia, we see there's very little care provided for these individuals. Okay. The next condition we're going to discuss is bipolar disorder. Okay. Now, bipolar is a situation where we have episodes of depression, then cutting with episodes of manic or mania, which is where they're very excitable, they have lots of energy, they keep trying to do things, or putting their energy into something. Bipolar disorder affects up to 2% of the population, and it's characterized by intense mood swings. They have episodes of depression, as we said before, and then episodes of mania, and they go from one to another pretty much at the turn of a switch. So you can be depressed 1 minute and 30 seconds later have tons and tons of energy and then do activities that ordinarily you wouldn't do. And one of the patients I had several years ago would suffer from manic depression. She would have areas of depression, and then she would have areas of mania where she would clean the entire house from top to bottom at 3 o'clock in the morning, or she would make food. From what I remember, she had a husband and a child, but she would make enough food for like 10 to 20 people. Because of these episodes of the mania, we just had to do something, keep doing something. So again, that's one of the problems that these people have. Now the good thing about bipolar disorders, we have effective treatment with medications and with psychotherapy. And a large percentage of these people that have bipolar, up to 2%, show great degrees of improvement and live normal, healthy lives, especially in the United States. Overseas in third world countries, if you don't have the money, you can't buy the medication or get the therapy, the improvement doesn't get better, unfortunately. Then we have depressive disorders, which is our next slide. Now, depression is different from manic depression. Depression is where you are depressed. It's broken down into two groups, which is major depressive disorder and unipolar depressive disorder. Basically, major depressive disorder is when you're depressed all the time, whereas unipolar depressive disorder is where you have episodes of depression, then you come out of it, become normal, and then you become depressed again. Okay, so it's like having bipolar without the mania. Okay, so you go in and out of depression, and this is the one that we tend to see more of in the United States. People get depressed and they come out of it, then something happens, they become depressed again. Okay, now when we have depression, some of the symptoms that we see are the inability to want to interact with other people. You feel tired all the time, you just can't focus on anything, so loss of concentration. Sometimes you may have physical symptoms associated with the mental ones as well. You start feeling sick, cramps, upset stomach, back pains, aches throughout your body, just don't want to deal with or interact with anybody, or have involvement to increase your quality of life, improve your quality of life. The good thing about depressive disorders is that there are medications and therapies out there to try and help you and improve you and improve your situation. Especially in the United States, we can go out there and get help. In the third world countries, it's really hard to get help because, again, medications cost money, and a lot of times there aren't enough healthcare providers to provide assistance in mental health. In some of the third world countries, they estimate there's one physician per 1,000 mental health care patients, which is insufficient. In the United States, that number is dramatically higher. We have way more physicians to access these patients, and we can see a physician quite easily if we have these disorders. In third world countries, a lot of times they're not even diagnosed, and there is no access to healthcare. Okay? Now, it's believed that 5% of adults worldwide meet the definition of depression during the course of 1 year. Now that statement's important because you have to understand that these people, even though they are depressed, this 5%, will come out of that depression. So from year to year, that number is going to be consistently at about 5 to 7 or so %, but the problem is it's not the same individuals from year to year with the same condition. So some people may be depressed this year, but better next year, then depressed again the following year. A lot of times it's the situations and circumstances that they go into that cause that depression. And if your quality of life or your situation improves, you're not depressed. And then when the situation arises again, the depression comes back. Also, I should have mentioned before, it's believed that 1 in 5 people that suffer from depression maintain that depression throughout their lives. Figure 16-4 gives a chart showing depression from population from year to year across the world, and we see that the United States and Germany at about 5%, Iran is about 7%, Brazil is at 4.5 to 5%, China is at 3%, India, Nigeria and Ethiopia are also at that 3 to 4% mark. One of the reasons that China is so low and yet has a high condition of mental problems is that people fail to report the number of the instances of these problems, and also a lot of these countries kind of suppress these numbers because they want people thinking there's a problem with their population or with their governments. Okay? So we tend to see underreporting a lot of situations. That's why we see that Germany and the United States have a much higher number than the third world countries. Also, it's believed that the people coming from third world countries are used to having less and harsher circumstances, so it doesn't depress them as it would someone coming from a more privileged country where they're not used to having less or going through certain situations. Okay. Now, depressive disorders are treated with medications and psychotherapy, as we mentioned before. Now, the psychotherapy can be cognitive behavioral therapy involved as well, which is where you talk through what the problem is and the patient comes up with a solution that's going to help them and improve their quality of life. The problem, though, is that there are a lot of barriers accessing mental health care. Perceptions to medications can be one, where people think the medications aren't going to help them or they feel better and they stop taking the medications. Financial costs globally is always going to be one of the biggest things because people can't afford to pay to see doctors or pay for the medications. If it's a cost of or a matter of paying for your food or paying for meds, these people are going to buy food and not medications. Okay, and also attitudinal barriers come into play as well. There's a perception that treatment would be ineffective, so they don't take treatment. And in some instances, there's a perception where people believe that if their family members are taking medications, there's a problem, so they want to ignore it and they stop their family members taking medications or deny the depressive disorder in the first place. Okay. Next we come to anxiety disorders. Now, an anxiety disorder is a fear that something bad is going to happen, either now or in the future. So what anxiety disorders or people that suffer from this are always concerned that something bad is going to happen, that the other shoe is going to drop, that something's going to happen to them. And it becomes something they become preoccupied with. Now we have generalized anxiety disorder where people worry all the time. Whether it's the weather outside, it's snowing, I'm going to have a car crash, I'm going to slip on the sidewalk, or I'm at the house, if I don't watch where I put my knives, I could stab myself as I'm going into a drawer. I mean, there's anxiety over everything. I had a friend who had an anxiety disorder, and it was to such a point where he, for 3 to 6 months until he got help, refused to go outside because he was convinced something was bad was going to happen to him if he walked outside in the street. This happens to a lot of people. We go through anxiety and we deal with it and we overcome it, but in some instances we can't. There are individuals out there who suffer from panic disorders where the anxiety is such they have panic attacks over and over again, and it's hard for them to deal with anything. Now these panic attacks can last for hours or days or just for minutes. When you have an anxiety panic attack or an anxiety attack, you have a rapid heartbeat, you may feel lightheaded, dizzy, fatigued, weak. Other things are you think that something's going to happen and you just feel like the stomach's cramping, you feel really, really sick and you just can't deal with the situation. It's important to understand that everybody goes through anxiety throughout their life. It's how we choose to deal with those anxieties that determines if we have a disorder or not. If you feel something's wrong, go ask for help and people will help you get through those conditions or through those situations and your quality of life will improve. Sometimes you may have to take medications to help you. Sometimes, and quite often, you need behavioral therapy or speak to someone to help you figure out how to modify what you're doing or the situations that you can survive and have a normal, healthy life. Okay. The next slide deals with alcohol and drug use. Now there's a specific test that's actually not mentioned on the slides called the CAGE test, or the CAGE assessment test. CAGE stands for CAGE. C is for cut down, A is for annoyed, G is for guilty, E is for eye opener, and it can be applied to any type of behavior that you think may be addictive. So whether it's alcohol, drugs, tobacco, or shoe shopping, the CAGE test can be applied. So the way we do the test is we ask the person or the individual the C question. Do you ever feel the need to cut down? Okay. So for example, if someone's a drinker, do you feel the need to cut down drinking? A stands for annoyed. So do you feel annoyed when people say that you have a drinking problem? G is for guilty. Do you feel guilty about having a drink? And then E is for eye opener. Do you have to have a drink first thing in the morning when you get up, or do you have to have a drink just to feel that you're alive and that you can function? If you answer yes to one of those, you have a problem, you may need to get help. If you answer yes to any two, you have an addiction and you need to get help. The more you answer yes to, the more serious the addiction is. Okay? So one problem, anything beyond that, get help, and it's called the CAGE test, and it will be on your quiz, even though it's not mentioned on the PowerPoints. Okay? Now there are A, B, C, D, E's of addiction. The PowerPoint just talks about the ABCs. A is for abstain, inability. Okay, this is where you cannot stop yourself from drinking. B is decreased behavior control, which means when you drink you can't control what you're doing, how you respond or how you act to other people. One of my friends was a drinker, and she was a very nice person until she was drinking. Then when she would drink, she would be very mean and say things that were inappropriate and upset and hurt people's feelings. And one instance I remember I'd heard, so I don't know if this actually happened, but she actually started throwing bottles and throwing people's at one of our friends who said that she needed to stop drinking. Okay. C stands for craving substances. You constantly want your addiction, so you always want what you're drinking or what you're injecting or what you're smoking, inhaling or something. So it's always going to be there. D is diminished problem recognition. It affects your mental awareness, so you think that something isn't going to be a problem when it quite can be. This can be seen with drunk driving. People are drunk, they can't stand, but yet mentally they think they can drive a vehicle and then put not themselves but other people in risk as well. I had a patient, I had a patient who was working in the emergency room many years ago, who was actually drunk, had a car accident, survived the accident, but the other two people in the car died, and the people that he hit in the other car all died as well. So again, he thought he was fine to drive, and he convinced other people he was, and got in the car and killed people. One of my cousins, when we were kids, when I was younger, was actually involved in a car accident and died. They just finished school, end of the semester. They got into a car from the south coast of England to drive back home to London. They'd had 2 or 3 drinks. They had a car accident and everybody died. So again, if you're drinking and you want to drive, stop. If you're with a friend and they tell you that they're going to drive and they've been drinking, call an Uber, call a friend that hasn't been driving, call a parent. It will save your life. Okay? If you have had a drink, do not get behind the wheel. Alcohol impairs people differently. One drink to me might be fine for me, but one drink for one of my friends, one of my family members that's smaller, has less size, is enough to put them over the limit. The legal driving limit in Illinois is 0.08. 0.08 is 1 beer, 1 shot of alcohol. So if you have anything beyond 1 beer or 1 shot of alcohol, you're already at the safe limit. Anything beyond that puts you above. And if you go to a bar and they're giving you a large amount of alcohol, that one drink is enough to put you over. Okay, so be very careful. Substances that people abuse are hallucinogens, inhalants, glue sniffing, spray paint huffing, opioids, sedatives, cannabis, caffeine, alcohol. One of the things that we've done in Illinois is we've legalized recreational use of marijuana. Marijuana on its own isn't as serious as some of the other drugs, but it becomes a gateway drug. People use marijuana, then they progress to something else that gives them a better rush or a better high. Marijuana legalization is more so for medical purposes, or people that be at home to help them relax and not be agitated. So if you are using marijuana recreationally, do it from the safe confines of your home. Do not operate a vehicle or anything, put yourself in any risky situations on marijuana, because it will impede your judgment. Okay. The next chart is figure 16-5, which discusses males on average consuming alcohol than females, and then we see in most of the developed countries, the United States, Germany, Brazil, we see, actually most countries of the world, we see a higher incidence of alcohol abuse. Now the disconcerting point is how many more males than females seem to be drinking. In a lot of countries it's a rite of passage for a male to be drinking, and it's a big part of a lot of social structures, or social environments, to go with your friends and have alcohol. It is something that we need to start to reduce, or try and reduce globally. The reason being is a lot of people get hurt because of alcohol, because of accidents and injuries, but alcohol does impair your body as well. Liver disease, liver damage, heart disease, some of the physical medical consequences of alcohol abuse. So again, watch what you're drinking, watch the amount of alcohol you drink, and try and minimize it. Alcohol is not your friend. Alcohol is just something that's been pushed down our throats to be socially acceptable. Many years ago, centuries ago, alcohol was an essential part of daily life, because water was so contaminated. By making alcohol, it removed the contaminants. So you would drink alcohol because it was healthier than drinking water. Nowadays, because of modern sanitization and the cleaning and purification of water, water is healthier for you. Drink water, not booze. Okay. Figure 16-6 discusses males more likely than females to report binge drinking. Again, men tend to binge drink more than women. It still does happen in women, but it's a lot more so in males than females. Okay. Age standardization for alcohol abuse is figure 16-7, and it discusses the fact that a lot of people aged 15 and older are consuming alcohol on a regular basis. Again, that's one of the things that we have to try and curtail. If you have children in your house and you have alcohol, monitor the amount of alcohol you have there. Make sure it's inaccessible to these children because they can drink it. One of the things that we've noticed is that children will drink and then try and replenish what's being drunk with water. So they'll drink some, say, vodka, and they'll try and refill that bottle with water to hide the fact they've been drinking. Okay? So again, watch what you have in the house, make sure there's no accessibility to kids for this alcohol. Know how much you have. If you think that alcohol is going missing, like beers from your garage fridge or per se where you store it, monitor it, and if you start seeing that beer is going missing and you're not the one drinking it, it may be your child. So we have to make changes and try and rectify that situation. It starts with alcohol, then it becomes something else. Other impairments can occur, so again, stop the gateways. Okay. Figure 16-8 is percentage of disability adjusted life years, DALYs again, due to loss of alcohol. We see that most of the developed countries, United States, Germany, Brazil, China, have the highest percentage of disability adjusted life years because of alcohol. Other countries like India and Nigeria, Africa, subcontinent, don't have as high a number from lost years because they're not able to access as much alcohol as we are in the developed countries. The reason being is alcohol costs money. If they don't have money for food, they're less likely to buy alcohol because they're using their money to buy food, okay, as opposed to booze. Okay. Figure 16-9 is types of alcoholic beverages consumed by litres of pure alcohol in featured countries. As we can see that Germany, Brazil, United States have the highest amount of beer consumption. After that we see a wine consumption, and then we see spirit consumptions. Whereas in China, people are drinking a lot, they're drinking a lot harsher drinks, for example spirits, which would be alcohol, vodka, tequila, whiskies and so forth. Nigeria and Ethiopia are drinking other forms of alcohol as opposed to beer, spirit or wine. Okay. Now, alcohol disorders we mentioned previously, the biggest one that we see is cirrhosis of the liver associated with alcohol, which is scarring of your liver. Hepatitis can occur, other forms of liver damage can occur because of it. Alcohol is also considered a precursor to cancer. If you're a heavy drinker, it means you're more perceptive to see developing cancer than people that aren't drinkers. Okay? And unfortunately, other disorders we see are unintentional injuries, falls, trips, car accidents, sometimes intentional injuries. If you have an underlying condition of depression per se, or manic depression, you can have episodes of mania depression when you're drunk that can put you or your family in harm and cause you to die at a younger age. Now, when we look at the numbers, men are more likely to become drinkers than females, but females are drinkers also. So don't just ignore the females that are drinking, because they can have severe detriment to their bodies and their minds as well because of the alcohol. So we have to try and avoid that. Okay, one of the things that we can treat alcohol is early detection. If we figure people are drinking younger, or we can determine that someone's drinking more than they should, we can have interventions and try and correct those situations and stop them developing this form of abuse or addiction. It all starts by having someone be honest and say, listen, I think you're drinking too much, it's not healthy for you, let's make some healthier choices. Let's find other avenues to get rid of what's bothering us rather than running to alcohol to try and fix those situations. One of the things that we did in the United States was restrict alcohol sales, increase taxes on alcohols to a degree, ban drunk driving, reduce the number of people driving under the influence of alcohol. They have had improvements. The problem is that there's still a lot of people out there drinking that shouldn't be, and we've made it such a part of our life in the United States that it's a rite of passage when you turn 21 to go get a drink. In other countries of the world, like for example where I come from in England, people go drinking to pubs and so forth at 16, and the situation isn't as dire over there because people aren't seeing it as a rite of passage, as something that people do. A lot of these people are actually using public transportation to commute around, which isn't as developed as in the which is more developed there than in the United States, which makes it less likely than to be drunk driving because they're riding the bus or they're riding the tube. But again, accidents and injuries still happen. But again, watch what you're doing, make sure you're not drinking to harm yourself. If you have a drink, one drink should be fine. Usually when I have a beer, for example, I'll have a beer and that beer may last me 2 to 4 hours. And that's just one regular bottle. And half the time, half that beer is left in the bottle. We actually have beer in my house quite regularly, but we're not using it to drink, we're using it as a cooking aid. So for example, if I'll make some sausages for the grill, I put a bottle of beer with the sausages and cook it that way. So the alcohol is actually worn off and you just have that flavour. So again, watch what you're doing with it. I always know how much I have in the house and I can tell if anybody's moving it, so I can determine if it's been used by someone inappropriately. You should be doing the same. Other drug use disorders. Cannabis products are one of the ones that are used most globally as illicit substances. Again, if you're doing it in the confines of your own home in a relatively safe situation, it isn't going to be harmful for you. The fact you have to realize is a lot of the cannabis you're buying is, if it's not coming from a legitimate store, it's being bought off the street, and your friendly neighborhood drug dealer just wants to sell you drugs to make more money. They'll add other things to those drugs so you buy more of those drugs and get you into harder drugs. At that point, they're selling you because all you want to do is get the drugs from them for everything you've got. They're taking everything you have, and they're not just pimping you now, they're pimping your kids and everything else. I had a patient when I was working in chemical dependency about 20 or so years ago who wasn't able to make enough money for her drug addiction. This was a female patient, so she started pimping out her daughter to pedophiles for drugs. She got her daughter addicted to crack cocaine, and that's how she got money. So again, it messes not just your life up but everybody else's. The best thing to do if you can't go to a legitimate pharmacy or dispensary for your drugs is to say no and not buy them, because you don't know what you're getting and it is harmful for you. Other mental health disorders, the biggest one that we see is about 2% of adults and up to 3% of children is obsessive compulsive disorder. Obsessive compulsive disorder is an anxiety disorder where you have a compulsion to constantly redo something over and over again. In healthcare workers, we see this more so with washing hands to prevent infections or prevent them from getting sick. It can be anything from checking to close the door 4 or 5 times to make sure you've locked it. These obsessives or these compulsions can occur because you did something once and forgot to do something once, and it starts to become an obsession to constantly redo what you've not done before to make sure it's done properly. An example with me was I one time left the house and I forgot to close my garage door. My wife usually lives after me, so she called me on the phone to say that I forgot to close the garage door, which happens. Okay, and unfortunately my wife is one of these people that's very diligent about checking after me. So what I ended up doing was I would leave the house, close the garage, drive up the street, turn the corner, not remember if I closed the garage, turn the car around, and then come back to see if I closed the garage. And I did that several times. And I said to myself, this is just ridiculous. So what I do now is I leave the house, I get in the car, start the car, I watch the garage door completely close before I put the car in gear to leave, so it wouldn't be a compulsive disorder for me anymore. And thankfully I don't come back and check the garage anymore.